Again, thank you all so much for being here. I'm really excited to introduce Donald Coleman and Dr. Ebony Coleman with their presentation on the benefits of self-care.
All
So
right,
much.
thank you so much. Thank you guys again so much for coming through. I know it's Sunday, everybody is getting ready for the week ahead, but thank you so much for being here with us. We're just gonna go ahead and briefly introduce ourselves. I'm Donald Coleman. I'm a rising junior at the Eastern Michigan University located in Ypsilanti, Michigan. Right now my major is biology with a double minor in psychology and communication. So definitely my area of interest right here. And I'm gonna let my sister introduce herself.
And as you guys notice, I'm always beaming with like just so much anticipation when he highlights himself because, of course, this is my brother. We are a brother-sister duo. And I'm just happy to know that I'm able to be in a scene where my brother is highlighting himself and he's celebrating his academia. But my name is Dr. Ebony Coleman. I have a bachelor's in psychology, a master's in forensic psychology, and I also have my PhD in forensic psychology as well. So we'll get more into how I cultivated that PhD and what I'm utilizing it in right now later in the presentation. But I just want to say thank you guys for opening up this time and creating space for us. And I'm excited to get into the things that we're going to talk about today during this presentation. So thank you.
Love that. Okay, so now I'm just gonna share my screen so we can get started. Okay, hopefully everyone can see. Can you guys confirm with me? Not okay, good. Good. All right. So yeah, this is the start of our presentation, the benefits of self-care, how proper self-care techniques can assist in preventing burnout in students and mental health practitioners. Presented by me, Donald Coleman, and my sister, Dr. Ebony Coleman. So we're actually just going to go ahead and start off with just some basic terms and definitions that you'll probably be seeing a lot of in our presentation. So we're going to start out with burnout. So burnout is defined as a state of emotional, physical, and mental exhaustion caused by excessive and prolonged stress. Self-care. Self-care is the practice of taking an active role in protecting one's own well-being and happiness, oftentimes during stressful periods or moments. And finally, social support, and that is defined as the provision of assistance or comfort to others, typically to help them cope with biological, psychological, and or social stressors. So what does burnout look like, just in a general broad of things? So burnout typically represents itself differently in people. People react differently to stressful situations. So here are just some of the more common things you see. If someone is easily irritable, always irritated, and usually they're not like that. Constant emotional and physical mental exhaustion. So if you just can't seem to get out of a funk, or if you just can't seem to wake up, you may get 9 hours of sleep and you just still feel exhausted. That could be a symptom of burnout. Isolation, so isolating oneself from friends, family, your community, your peers, etc. And another key sign is a weakened immune system. So you're constantly getting sick, and when you do get sick, typically those symptoms last a lot longer because your immune system is under so much pressure from the stress that you're going through. So yes, like I stated earlier, burnout and exhaustion looks differently in different people because people stress and how you handle it is very unique to that individual. So what does burnout look like in students? So here are some things while I was doing my research on academic burnout. So this kind of burnout is present in students in higher education institutions, so a 2-year, 4-year university or college. So persistent signs of exhaustion. So for example, you're coming home from class or lecture and you're just constantly tired and fatigued. Like you could do everything, drink a cup of coffee, maybe a Red Bull, and you're just still not feeling it. Social isolation, I forgot to put the example, but for example, you may be belonging to a lot of clubs or sports, and all of a sudden you just start to withdraw from those things. You just don't find pleasure in those things, and you just rather prefer you be by yourself. Your grades are starting to drop. So you may be performing poorly on tests or exams or just any classwork. And you may not be that kind of student, but it's just your body is so tired that you just can't physically put yourself to do the work. Anxiety and depression, like I said earlier, loss of interest, so in your personal and academic life, and you may have trouble concentrating, whether it's in class or on assignment. Those are just some of the things to look out for in academic burnout. So one of my research, I'm going to move this little box over to the center. I can't see. But as part of my research for this presentation, I wanted to look into something more current as we're still dealing with the COVID-19 pandemic, sadly. A lot of us students had to move virtually online these past couple semesters. So there are actually some research going on right now into student performance when it comes to COVID-19. So as part of one of my studies that I looked into, studies indicate that students during the COVID-19 crisis have experienced an increase in exhaustion and professional efficacy and cynicism. I hope I'm saying that right. But so in this research that I pulled, questions were divided into 3 sections. Students were questioned and analyzed using the MBIGS. For all of my mental health practitioners out there, you may know what that is, or if you're a psychology student, you might know what that is. And then questions were answered by ranking them between 0, which is never, or 6, every day. So I'm assuming the questions were talking about just how are you feeling with school being done during the pandemic and just online schooling in general. Students also report the barriers to online learning, such as finances, Wi-Fi strength, hardware and software, and just an environment in general. It leads to faster mental exhaustion because you're already going through school. And as we all know, school is not a cakewalk. So you're going through all these barriers and it's just leading to faster mental exhaustion, which will cause academic burnout. And also within my findings, students of color, first generation students, and students of low economic standing oftentimes experience burnout faster than their respective counterparts. Obviously due to social economic standing and etc. Burnout, evaluating your psychological well-being and learning motivation. So in this section of my research, I want to talk about these sociological factors as it relates to academic burnout. So as you can highlight right here, burnout, psychological well-being, social support, and learning motivation are factors that attribute to academic success. So those key factors right there will play into whether or not a student will thrive or do poorly in a given semester. Students that have a strong social support tend to perform better academically and have much more motivation. In my research that I was looking through, students were asked whether or not that they had strong connections to whether it be friends, family, peers, fellow peers, or just their community in general. And students who answered that they felt like they have a strong connection to their peers and their community, those students had higher GPAs and overall reported just higher well-being and psychological well-being. So as a conclusion of that research, students should ideally place themselves in collaborative and cohesive environments to help support high academic and psychological well-being. I would also like to note that in this part of the research, it was conducted in Chinese universities, and these are Chinese students. So some of these factors may or may not apply to US students, but more research will have to be conducted to find that out. How to manage burnout, self-efficacy, and self-care. So I highlighted some tips that I also found during my research. So first and foremost, take time to realign any current goals or aspirations and integrate them into future planning. So if you may feel burnt out right now, that's okay. But just as long as you're finding productive ways to manage it, I think personally will be the key to success in learning how to manage it. Two, take time away from school, work, and focus on areas that trigger stress. And I know you're probably looking at me like, why would I take time away from school and work? But that's actually pretty essential to figuring out what are the stresses in your life and what you can do to manage those stresses. Because let's be real, we can't avoid school and we can't avoid work stress, but I think you learning how to manage those stressors will definitely be the key to managing burnout. Three, try introducing a productive hobby or habit to day-to-day activities. So for example, I listed going to the gym, doing yoga, meditation, reading, painting, just any productive habit that you can just incorporate into your day-to-day will definitely help you manage that sense of tiredness or that sense of fatigue or not belonging. Those will definitely help. And four, if these symptoms persist or if they do worsen, please make an appointment with a mental health practitioner. So if you are at a university, I know some universities do offer students free counseling, free therapy every semester, every year. But if your symptoms are managing to get worse, then you should definitely make an appointment with your local mental health practitioner. And with that being said, these are my research references, and the second half of this presentation will go to my sister.
So as you all know, after you are a student, then you become a student in a profession. And I always say I'm an avid learner every day because although I do have my degrees, you are constantly learning. You are constantly taking evaluations on yourself and realigning what you've learned to new information. So that's why you become a student, then a student in your profession. So what we're going to talk about now is burnout in mental health practitioners. Okay, thank you. Why it is important to stay ethically compliant as a mental health practitioner. So under guideline 2.06 in the American Psychological Association states that mental health providers are to ensure that they are maintaining their highest level of competence when interacting with clients. So when you go into the field of psychology, there are ethical standards that are derivatives of the APA, the American Psychological Association, that states these guidelines, in order to stay in alignment to being ethically compliant and being able to practice, you must abide by these guidelines. So in the event that you are feeling signs or symptoms of burnout and you're actually going through burnout, you are at that point not supposed to practice. At that point, you are supposed to seek assistance, seek guidance in regards to trying to figure out what is the foundation or what's triggering you to feel these symptoms of burnout, and then seeking assistance from a fellow psychologist or fellow psychiatrist that can assist you in getting back in alignment to being ethically compliant. So my research study was able to fill the gap in literature by examining and exploring of mental health practitioners' perceptions of ethical requirements and self-care as a means to stay ethically compliant. So before we go to the next slide, I do want to talk about what the gap in literature was that I was able to see and how I was able to take my research to fill that gap. So the gap in literature in regards to burnout was that we needed to link burnout directly with competency and providing quality of care. So before my actual research, there was not any research out there that directly linked self-care to competency and how they were able to go about making sure that that happened. the theoretical framework of burnout. So in my research study, I looked at qualitative research, and I was able to derive positive psychology theory from that. So in the positive psychology approach, I looked at an individual's resiliency and how it's correlated with their ability to control the cognitive source of their concerns. Mental health providers' ability to have resilience, longevity in their field, and their ability to stay ethically compliant may be attributed to innate characteristics of the mental health provider, in addition to their ability to have effective coping skills. So looking at this, I want to take out the fact that resiliency was something that my brother talked about, right? So when you go through different life challenges, you over time have that fight or flight aspect, right? So either in resiliency, you're going to look at it, you're going to learn from the different challenges that you go through, or you take that challenge and build upon it, or you might look at that as a factor that you don't want to go through again anymore, so you run from it. And sometimes when we run from things that are challenging to us, and then it's presented again in the mental health field, because we're giving and we're constantly pouring into others, we can look at that as a draining aspect. I know that I have to see this particular client, but this client triggers in me something that I used to run from. And now I have to constantly go and I have to constantly pour into somebody that I didn't even allow myself time or space to pour into me. So in that regard, that can start the foundational crux of what burnout can look like in mental health practitioners. Over time, seeing that patient is then triggering you, and you're constantly trying to go up an uphill battle that you weren't even equipped for, because these are challenges that you didn't equip in your personal life. So looking at positive psychology theory, that's where I was able to extrapolate different themes, and I was able to extrapolate how these things can then trigger burnout in mental health practitioners. I also looked at the longevity in the field, right? So when you're talking about mental health providers and how they have years of being in the field, that years of being in the field can come with confidence. Over time, with the confidence of having success stories in your patients, having success stories in your clients, that can build up your confidence. Over time of making research articles or doing your own research and maybe becoming a published author of your field, you then have a specialized care. And within that specialized care, you are then the expert in your field. So the longevity in the field, that can assist some mental health practitioners in building up their resiliency and their ability to stay ethically compliant as well. Another thing that I wanted to look at was the effective coping skills, right? So although we talked about effective coping skills in students, mental health practitioners, when you actually get into the field, you definitely need to also have those effective coping skills, but sometimes reevaluate them. Maybe things that you looked at and learned from when you were a student, when you evolve into your profession, those coping skills that work then as a student may not work now in your profession. So I always tell people, and especially in this research, I looked at what those effective coping skills are, and are they actually effective for you? After you maybe go for a run, or after you do grounding exercises where you go outside and you become innately aligned to Mother Nature, does that really help you? Did that only work for you when you were a student, or were you able to transition that now into maybe a family, maybe work-life balance in regards to other interpersonal relationships that you have going on? It's always effective to look at these coping skills and align them to where you are currently in your life, so that when you do become interactive in them, they are not antecedents to your burnout, but antecedents to allowing you to be successful and stay ethically compliant. So in analyzing burnout, I was able to look at phenomenons. So the first phenomenon that I looked at was the phenomenological inquiry. So in the inquiry, I was able to talk directly with mental health practitioners. So in my research study, I not only spoke with psychologists, I spoke with mental health aides, psychiatrists, people that have private practices. So they might be wellness coaches. I was able to look at whomever falls under this wide umbrella that we have of mental health practitioners. And I was able to inquire on how they were able to utilize self-care techniques, and were these self-care techniques really assisting them in being effective and making sure that they stayed ethically compliant. So the next one was the phenomenological reduction. This one is my favorite. So outside of the fancy word, it's basically looking at what the person is telling you versus reality, and then taking those two and allowing the positive psychology theory to assist them on their journey of not feeling burnout. So I had some of my mental health practitioners that I interacted with. In their reality, they were seeing maybe one or two patients that were not being successful. And when I say not being successful, recidivism, especially if you're going into the field of psychology, is going to be something that we all experience. You're going to see that one patient that maybe your CD patient, which is an acronym for chemical dependency patient. You might have an MH patient, which is an acronym for mental health patient, that not only do they go through the full inpatient procedure, you're assisting them, they have this great treatment plan, then they go back in society, and then maybe 30 days or maybe even 2 weeks later, you see them back in treatment. And for some mental health practitioners, that is them looking at their practice being a failure. They're looking at that as being a representation of them not being a great mental health practitioner. So when I did the research, I was able to look at what they were telling me, and then having a separate reducted conversation where we were able to look at reality. And reality is, if you have, let's say 20 clients, and maybe only one or two is experiencing recidivism, the reality is the ratio is not as bad as what you're focusing your whole thought process on. So that's a part of the analyzing burnout. And from there, I was able to use structural synthesis. So structural synthesis, and for all my psychology students, this is something you're going to need to do if you're going into qualitative research, so get ready. After you do your interviews, you have to then look at themes. So in your structural synthesis, I was able to use in vivo, right? It's a program that allows for you to break down themes in qualitative research. I was able to find 4 themes. The main 4 themes were A, personal self-care practices, B, establishing boundaries, and 3, spiritual balance, 4, of course, being the balance. After that, I was able to look at 3 larger over-encompassing subordinate themes, because each one of those themes you have to then put into things that are bigger than that, right? To make it manifest across borders of all practices and mental health practitioners. So from there, I looked at building inner self-care rapport, establishing mental health practitioner and client relationships, personal and professional balance. So of course, with all research, as my brother stated too, there is limitations. So in this slide, I'm looking at limitations of burnout and the implications of social change. So one of those limitations stemmed from participants not being provided with 13 interview questions in advance. So my research study required me to go in and have this one-on-one conversation with mental health practitioners. I chose in my research study to not give them the 13 questions before, because I wanted the phenomenological reduction to be something that was accurate in the moment and not responses that was based upon practices, but in alignment to research that could be looked at as limitations, because some people are just not equipped to answer questions verbatim like that. Some people should feel as though they have preparation. So that is a limitation in research. The second is stemmed from the perspectives and experiences of only 8 mental health practitioners in the state of Georgia. So I do currently reside in Georgia. My research is a derivative of where I stay in the state of Georgia. So it might not be applicable to other states. This might be just the perceptions of mental health providers here. Also, I only used 8 mental health participants. I wanted to be able to get themes, and I wanted to apply these things and have time to structural synthesize them. So with that being the case, I chose 8. There are other studies that use larger populations, but because in research you have to look at limitations, this could be a limitation in my research study. So I also looked at the implications of social change. Minimal self-care days or self-care reward systems is 1. The cost of resiliency is 2. 3, more studies need to divulge into strategies of how mental health practitioners can feel better supported within their profession through a deeper understanding of the mental health of practitioners and their self-care needs. Ethical violations can be minimized, and more mental health practitioners may stay ethically compliant. Self-care recommendations for mental health practitioners. So the 3 that I wanted to share with you all today, and of course in my research there's more, but mental health workers being aware of their personal mental health, it's very important to take that PTO, right? Take those days off, take that vacation. It is okay. Your clients will still be there when you get back. Life will still go on without you being at the hospital or without you doing that research right then and there. If you cannot pour into someone because you have not did the work on yourself, what good are you as a mental health practitioner? Always remember that. The next one is positive theory affecting perception. Keep your social circles around you, and this could go for students too. Keep a social circle that keeps you feeling good about who you are, affirming your journey in academia, allowing you to feel rewarded through your educational endeavors, because allowing your mental and your cognitive thought processes to be highlighted and aligned to something that is positive will keep you into a positive space and allow for you to think through a lens that is not maladaptive, right? And for my psychology majors, this is another term. Maladaptive thought processes are adaptations that we take on when we are thinking in a way that is dysfunctional. So surround yourself with people that understands your journey, that you can vent to, and that can assist you on your journey of staying aligned in that positive mind thought process. The next one, of course, is supportive environments. In the world of school, you have that guidance counselor, you have that professor that you can talk to. When you become a mental health practitioner, same thing. Keep you a peer, keep you another psychologist that you can staff cases with, because it is important to sometimes staff with other people so that you are looking at the lens of multiple different lenses, and so that your own personal biases don't become a reality for your patient or your client. So if you would all like to look at my research in regards to an exploration of mental health practitioners' perceptions of ethical requirements and self-care as means to maintain professional competence, please look up my research at this link that I have highlighted here. You will be able to order my actual research book, whether you want the hardback or virtual link at ProQuest. Thank you.
And that is it for us. Thank you guys so much for joining us. It was truly a pleasure giving this workshop. Both of our emails are listed. If you do wish to contact us, you can follow us both on our Instagrams And yes, there's more of us. So we have a podcast, Unapologetic Conversations with the Colemans. One of our main themes we talk about is mental health. And considering May is Mental Health Awareness Month, you guys can go check us out there. We are available on all streaming platforms and YouTube. So we can leave this 5-10 minute Q&A if anyone has questions.
I did want to add in there too about in regards to if anyone is in search of wellness coaching, make sure you look up my website at drebonycoleman.com. On there, I do have other wellness tips like ebooks. I have fitness wear, and I also have a vitamin supplement line that I cultivated as well from my research on self-care. All right, let's have those questions. We're ready for you.
I'll stop sharing the screen so we can see.
So the first one I see is, can you talk a little more about positive psychology theory? Of course. So positive psychology theory is looking at the foundation of where our resiliency comes from, right? So you could be looking at the upbringing of someone's, maybe self-worth, self-value, and how they value and interact with their clients could be a derivative of their upbringing. So maladaptive thought processes, I always like to align to that, because sometimes if you're brought up in an environment that wasn't innately like nurturing, sometimes as a psychologist, when we're interacting with our clients, that might be a boundary for you when it comes to nurturing and looking at what it is the client needs from you. As a psychologist, you might think that they're encroaching on your boundaries, when really that might just be a boundary that was inputted in you and your upbringing. So with positive psychology, which I think is so lovely, you look at the aspect of benefits of having an interpersonal relationship with another cohort or peer that is aligned in the same profession as yourself, right? So you're looking at, if Donald was a psychologist, I would staff cases with him. I would have a confidentiality agreement with him that what we staff stays between him and I, so that I have someone to bounce ideas off of, so that my own personal biases or my own boundaries that I had innately growing up does not become something as a barrier between myself and my client. What do you recommend for students, this is you, Donald, what do you recommend for students how to deal with burnout when they are in the very busy, went away. Let me open it.
Tight schedule, such as a quarter system.
There you go.
So yeah, that one is for me. Definitely, I would recommend creating a system of scheduling, because I noticed while I was pulling up different sources and scholarly articles, a lot of them had to align with students not feeling adequately prepared when it comes to classes. So definitely scheduling, like creating a solid foundation of, okay, I have a daily routine, because with a lot of students, we get so caught up in the semester, we forget to plan stuff out. Assignments catch up on us. So that leads to further mental and emotional exhaustion, which leads to academic burnout. So that is definitely one step in direction where you can kind of prevent that early on, is definitely creating a solid daily routine, whether that's something you write on a whiteboard or use Google Calendar. I know a lot of us know Google Calendar, and you can definitely get a physical planner and use that. So just one of the things I would recommend for that.
So excited that you said the physical planner. When you guys listen to, or if you have an opportunity to listen to our podcast, that is one of the things that I harp on all the time. Structure, structure, structure. Get you an accountability partner. I keep my planner with me 24/7. I make sure that it's small enough to be portable and to travel with me, but large enough to be a reminder that whatever I put in my planner is something that I'm accountable for. We always have responsibilities to other people. Sometimes it's okay to be responsible to your own goals and your own dreams. So after every week, I go through my schedule. I make sure that if I didn't accomplish something that week, it gets transferred over to the next week. And I just do that until at the end of the month, I'm able to look at all these small things that I was able to accomplish just by being responsible to myself and to my goals. So,
Yeah, seem I struck a nerve with the Google Calendar because if you are in school right now, you know Google Calendar comes in
yeah,
very clutch.
yeah.
So yeah, any more
More
questions?
questions?
You can also speak if you can't. I think you guys will allow that. You can speak it if you don't want to type it out. Questions,
Yeah,
comments,
I have a quick
concerns?
question. You both mentioned limitations of the research you discussed. So do either of you have any ideas for follow-ups to just sort of confirm what you found or, be able to expand on the data a little bit?
I love follow-up, right? Because it gives me another opportunity to learn new things. So when you do follow-up research, you're hoping that where you left off, right, that someone picked up. So for a lot of you all that might be looking about going into a PhD study or some type of doctoral program, you always want to look for limitations. So this is where I'll step in, and then Donald, I'll let you go after. So for me, when I was looking at limitations in research, I was looking for ways for me to fill gaps in literature, right? It's so hard at the end of your journey when you are trying to become a doctoral candidate to think like, oh my gosh, what am I going to write about? They want me to construct a dissertation. It has to be 5 chapters with research. It's millions of years out there of research. What am I going to write about? So I would like to recommend for you all that are thinking about going on that journey or encroaching upon the time of writing your dissertation, look through research, look at limitations in research, and from there extrapolate and align what you want to write about based upon limitations that are already out there in research.
Yeah, no, definitely. Definitely agree with you 100%. When it came to my research, specifically the last half of it, I did note that the research was conducted in Chinese university. It was 3 Chinese universities. So there are limitations with that, right? Because you're doing research, first of all, in a completely different country. And those sample of students, so a lot of things may or may not overlap with some of the norms that we experience here, right? So I think when it comes to any kind of research, that you obviously look at the data. I think the data obviously comes first 100%, but also when it comes to limitations, figure out whether or not that it is something that is will get in the way of your overall goal. So when I came up, found this article, I determined to use it in the presentation because a lot of the data kind of supported what I wanted to talk about, as well as it was just an interesting piece to do. So,
The next question that I see on here, Donald, is for those working in healthcare, what would your advice be to reduce burnout since they are already working X amount of hours to keep up with the demand? Oh my gosh, definitely, definitely. For me, find exactly what it is that you enjoy and do it every day. And when I say do it every day, if it is 40 minutes of cardio is something that you like to do. I'm a runner, right? I'm currently prepping for my first marathon with my father, which will be in October, the Detroit Free Press Marathon. And so I love to run. It gives me my dopamine and my serotonin. For all of those that are out there in psychology, that's another thing that you'll be looking into. And it gives me just a sense of accomplishment, personal accomplishment. And I noticed in the beginning, when I first became Dr. Coleman, I was giving and giving and giving, and I was forgetting about my own personal self care. So, what I do now is I have my planner, and every day I have an allotted time of personal self care that I allot for myself. It is an hour just for me. So, in that hour, I get out there. If it's a nice day in the state of Georgia, I put on my running clothes and my headphones, and I'm running during that time. Put my phone on do not disturb, and I give myself grace. We create space in the fields of mental health for our clients. We create space for our coworkers and for others. During that time, I create space and grace for myself. And I make sure that it is something that's on my Google Calendar or in my actual binder for me. So just make sure that you create that time for yourself and make sure it is a daily habit for you.
That's a good way to answer that question. Considering I'm not in healthcare, respectfully, I can't answer that question. But we do have a question. It was for me. Did I find any specific cultural risk factors when it came to Chinese university students? So for that research article that I found, it only listed the participants, how many participants there were, their gender, and whether or not they were post-grad students or undergrad students. It didn't mention anything when it came to students, dividing them up on like socioeconomic standing, like things like that. So I'm gonna say no, I didn't find any specific risks. And you had a follow-up question. I think this is for you, sister. If
Oh,
you're
I see it.
pursuing tenure and you're
Yeah, I don't know if you are pursuing tenure in the future, which can be a daunting task. How can we alleviate such anxiety for future career goals, knowing that they are hard to achieve? Okay. So, and this is another thing that I talk about on our podcast. I love everything to be structured, 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 right? That's why I love qualitative research, because I was able to structure everything that I wanted and get those higher themes and make it look all pretty and beautiful, right? Reality is that is not the case. When you are looking at future goals, it is great to have them as something that is attainable, something that you're working towards. But the key word is working towards. Doing things in small increments allows for you to reach that career future goal in a way that doesn't burn you out and in a way that keeps you excited about the future goal. So I definitely learned that on my journey of writing my dissertation. Every day, just like I did about allotting time for that personal self-care, I gave myself a certain amount of time to write and to research. And I would like to hand that off to you as a recommendation. Structure your day. If you're feeling anxious about the future and you're feeling like the future is just like right around the corner, I'm not ready, I'm not prepared, give yourself a structure of in regards of how you're going to do small goals every day to achieve that. And that, to me, has been something that has allowed for me to do things and not feel burned out about it, to do things and feel accomplished and highlighted in them, because I gave myself enough time to still have that work-life balance during the process. Yes.
yeah, I love that response.
Thank you.
Yeah, no, definitely. Just to kind of add on that, too, is just that with any kind of task, whether it's or not task, I'm sorry, any kind of goal, whether it's long term or short term, I think it's important to take it day by day, right? And we hear that, and it's like it's so cliche, like day by day. What does that mean? It's literally day by day. Like do something every day, whether it's something that's time consuming or it doesn't have to be. It can be 10, 15 minutes. Definitely just every day work towards that goal, because what's that saying? Like Rome wasn't built overnight. That's kind of true.
Yeah, that's very true. Yeah, and you know what? You have to keep like-minded people around you, right? And I talked about this during the PowerPoint presentation, is keep people around you that are antecedents to your future goals, right? So if you are the smartest person in the room, maybe sometimes we need to change that room, right? The dynamics of that room. Get into rooms that make you feel uncomfortable. Get into rooms that challenge you. Get around people that are doing the things that you want your future to look like, right? So even taking conferences like the one that you're sitting in today, asking these questions, the only dumb question is the question that you didn't ask, right? So when you get into those spaces, pick the brains of individuals that are accomplishing these things, because trust me, everything that is packaged beautiful right now When you open it and you start peeling back the layers of what they had to go through to make that package look beautiful is what you're probably feeling right now. So get into the brains of the individuals that's doing the work so that you can understand the process that they had to go through to get to this point. One, because yes, you want their wisdom, but to two, it's a validation, right? It allows you to understand that you're not alone. It allows you to normalize the feelings of feeling inadequate, right? Sometimes the feelings of this imposter syndrome. All of those things are a part of the journey. But I want to give you this time to realize that the journey is only as beautiful as you make it. And the journey to becoming a mental health practitioner, becoming whatever it is that you're studying right now, it will happen, but nothing will happen overnight. Yeah.
Thank you so much for the opportunity. Thank you. We really appreciate that.
Yes. Any
All
more
right.
questions?
Those are all the questions I see. We are running a little bit over time, which is totally fine. Just want to give everybody the opportunity. If you have any questions, would you both mind putting your emails in the chat or your contact info in the chat so people can reach you if they want to? Thank you all for coming. Thank you so much to Donald and Dr. Ebony Coleman for being here with us today. We are so glad you joined us for our virtual Reclaim Mental Health Conference. It is now over, which is unfortunate, but thank you for participating. Thank you for being supportive of mental health. I hope you all learned something in your time today and yesterday. We hope to see you again next year. Thank you all so much for being here.
Yes, thank you so much for inviting us.
Thank you so much. And thank you all for tuning in.
All right, and there